And welcome back to Your Carolina. Bill Love sitting in for one half of Love and Hudson.
Right.
Sitting in for Jack Roper, who will be returning Monday. And sitting to the left of us is Dr. Daniel Nickles, who is a dentist in our area. And you guys were reminiscing and everything. Yeah. You used to listen to Love and Hudson. Now you can listen to him again.
Since 1991.
Look at that.
It's just, I heard it
all shucks.
Every morning, every morning.
I love you. And
right.
you were my the dentist for my uncle and aunt.
Yes, sir.
Talking
Absolutely,
about that.
yeah.
Well, I'm guessing that things have changed since 1991 when it comes to not only radio but also dentistry.
Right.
And that's kind of what we're going to talk about today.
Absolutely.
Are some advancements in
Sure.
technology.
Yeah. One of the greatest things is, year 2000, 21st century rolled around. And dentistry in the last, really 10 years has made a giant step forward. One of the newest things that we have in the office now is a dental laser. And people start thinking lasers, they start thinking about, Star Wars.
Yeah.
Okay. Take, these.
Actually, I think
things,
Austin Powers,
Austin
but
Powers.
go ahead. Keep going. Keep going.
even better. But, we're getting to the point where we can start doing a lot of great things with the new technology. And as we step forward into that, one of the great things we're doing now with the laser is we have the ability to do scalpel-free surgery. And people go,
I like that.
Wow, how does that work? I said, well, back in the day, we have to see what we're going to work on. And, we have to cut you open. We have to look inside. You want to do some,
Right.
Dental surgery, we have to cut the gums, that sort of thing, and get into where we can see. Now with the laser, we can use just a very small little probe. I mean, it's smaller than the thickness of a pencil lead. And we can run it into the gums. We can treat the gum disease. And back in the day, it was more of a mechanical type, process of, scraping. The people, you want to scrape my gums. You were scraping the teeth. We're getting the tartar off the roots.
Awful. No wonder we were afraid to go to the dentist.
Nobody likes to come to that. Well, now I'll take this small little, probe, if you will, the size of a pencil lead, and I'm able to place it into the pocket, and the energy off of the laser cleans off all the calculus to root surfaces, and it actually sterilizes the pocket, killing the bacteria that we were kind of, back in the day, we would, debride it, sprinkle some pixie dust on it, and pray to God that, this would heal well. Some people did it, some people it didn't. Now we can actually sterilize the pocket right there, and our success rate has gone through the roof, and no more scalpels.
I'm still thinking about pixie dust. But okay, so that is probably, one of the things that you have said in a lot of your commercials, if folks have seen you on TV,
Right.
is if you've been afraid to go to the dentist,
Sure.
I don't judge you if it's been 20 years. You see that all the time. People
Every
think
day.
they're the only ones.
Every day, yes.
And it's those old things like scraping your teeth and hearing that drill and stuff that scared people
Sure.
away.
And, my analogy to that is when I was a child, I reached up on my grandmother's stove, and the burner was black, and I went to push away, and she just turned it off, and it was still hot, and I burned myself. I've done that once in my life. And if you go and you have a bad experience, your brain doesn't want to go back and go, let's go do that again.
Right.
And every day, literally 3 or 4 times a day, I have my new patients in the chair for their, big appointment where they do the pictures, the x-rays, and we discuss, what their desires are, what their fears are, and what happened. Everybody thinks, I'm the only one. And every day I'll hear, they'll walk in my chair and they say, when I walk in the room, they'll ask me 2 questions. They say, are you really as nice as you're on television?
Are you?
And absolutely. And they'll ask me, would you really not judge me?
Yeah.
And it breaks my heart. And I've heard people say, they've had people fuss at them.
Because the scary part is they've been afraid to go because of the old pain or the old bad experience. And then
Right.
they get 5, 6 years down the road, and then it's a different reason. Now I'm afraid to go because he's going to think I'm crazy because I haven't been in 5 or 6 years.
And you might have a sensitive place, and you're really nervous about the dentist touching that and being uncomfortable.
You hear that, please don't touch this,
Right.
because we always pick up the mirror and the probe, or the mirror to explore.
But the thing that we want to
the eyes
leave
get really big.
everyone with is there's new technology.
There's new
There's
technology.
less pain. And if it just freaks you out too much, there's even sedation nowadays.
We sedate every day. It's like one of those things of, let's take you to where you need to go in the best way possible.
Right.
And so it's just, it's connecting, is finding out what you need. We've got the tools. The most important thing, I think, is just listening to the patients. What happened? Here's what I can do. What can I do for you?
All right. So if you've convinced someone out there, where do they find you?
Been in Lake Forest Shopping Center for 22 years, 1330 North Pleasantburg Drive. So office number is 244-3211.
All right. Thank you.
Okay.
Dr. Daniel
Thank you.
Nickles. Okay. And we have something, a wedding show that is coming to the area. but it's just for grooms. I know. We always think of bridal magazines, the bride wants to go pick out the dress. All for the grooms. Yes, Modern Mister. When we return, stick around.